Hey guys, happy Friday. Thanks for joining me for my weekly Facebook Live. If you haven't met me, I'm Dr. Jennifer Greer. I'm a board certified plastic surgeon in Cleveland, Ohio. And every week I ask my loyal audience for questions about plastic surgery. And we have a couple great questions to talk about today. Before we get started though, I do want to take a second to talk about sugar. Why sugar, you ask? Well, weight loss is kind of my jam. I lost 45 pounds over the last year and a half through a lot of different techniques. And sugar played a really big role. Back in the 80s, we thought, oh, it's fat. Fat is bad. And everybody cut fat. And the resulting change in foods was we just added sugar to everything to make it taste good. That's what the food manufacturers do. It's either salt, sugar, or fat, or God bless them, all three, to make food taste good. So when we did low-fat everything, the level of sugar in our food increased astronomically. Sugar tastes good. We like it. We ask for it. So there's a ton of sugar in our food. And it turns out fat really isn't the culprit for weight gain. It's sugar. It's sugar and processed carbohydrates like flour. And sugar is so bad for your body in so many ways. It's something we've evolutionarily adapted to like, because foods that were sweet were higher in calories, and that gives you a little bit of an advantage if you're eating the stuff that gives your body fuel. But the amount of sugar found in fruit isn't like what it is in processed food. The other thing is fruits have pectin, they have fiber, they have other things that slow the absorption of sugar compared to all of our processed food, like granola bars. They seem healthy, right? But they're chock full of sugar. Breakfast cereal, also full of sugar. Yogurt seems like a health food. It masquerades as a health food, but Chobani yogurt has 19 grams of sugar per container. That's huge. That's like drinking a can of Coke. It's just not even healthy. Sugar is really hard on your body. Not only does it increase the risk of insulin resistance, which leads to diabetes. Basically what happens is your pancreas is pushing out all this insulin, because you're eating all this sugar, and then your cells are like, whoa, too much insulin. So they get resistant to the signals of insulin. And that makes your blood sugars go up, which makes your pancreas kick out more insulin, and then your cells stop listening even more. Imagine if speakers were turned up too loud and your ears couldn't take it. You're gonna turn that signal down. That's kind of what your body does. And over the long term, that leads to insulin resistance and diabetes. But that's not the only thing sugar does. It also increases inflammation. And systemic inflammation, we're learning, is responsible for so many diseases. Not only autoimmune diseases like rheumatoid arthritis or lupus or irritable bowel syndrome, but even heart disease. The old theory was that eating fat in your food with cholesterol was the big thing. Dietary cholesterol led your arteries to start collecting that cholesterol on the sides. The new theory is that inflammation in your body creates an injury on the side of the vessel wall, and then the cholesterol collects there. So it's not eating the cholesterol that's causing the problem, it's the inflammation, and sugar causes inflammation. So added sugar is really hard on our bodies, and it's something we eat a ton of in America. There's a great documentary called That Sugar Film. It's an Australian who tries to eat the amount of sugar that's in the average American diet, and he does it with all healthy foods. So granola bars, yogurt, smoothies, breakfast cereal, things that are marketed as healthy. And it's got some pretty profound effects on his body. So I would definitely recommend watching that. Now, if you want to hear me talk a little bit more about weight loss, I have a free 1-hour masterclass. It's an online webinar, so it's totally virtual, and that's coming up next week. I've got 2 dates and times offered. If you want to register for that, just go to jennifergreermd.com/masterclass, and you can hear me talk a little bit more about weight loss and what I did to lose 45 pounds. You'll get some great tips to help speed you on your weight loss journey. All right, so that's the weight loss portion for today. And then we did have a couple viewer questions that I want to answer. The first one, let me grab my notes, is what is the best filler to correct the under eye area? And the reader specifically mentioned Restylane versus Juvederm Voluma. So Restylane and Juvederm both come in several different formulations, basically from like thinner and more pliable to thicker. They're both hyaluronic acid, which is a gel. It's basically joint fluid, the thick viscous fluid that lubricates naturally in your body. hyaluronic acid is a component of connective tissue, so it gives skin some firmness and elasticity. And basically, they're both fillers, so you inject them to plump up and add volume. Now, the fillers meant for the cheeks, Juvederm Voluma or Restylane Lift, are very, very thick, so they add some structure. And then they have thinner, more pliable versions. For Restylane, that would be the silk pliable version that I'm aware of, but I haven't used that one as often lately. So when we want to correct, this is called the tear trough. It's basically that nice groove under your eye that makes you look tired. There are two options. The first is to add volume right over the cheek. That kind of plumps up the cheek. It corrects that hollowed out look that a lot of us get as we age, and it's going to soften the transition between your lower eyelid and your cheek. That is a great option, and that is what I do probably 80% of the time, maybe even 90% of the time. The second option is to add filler directly into the lower eyelid. That can be really effective and it can look amazing, but it also comes with a few potential problems. First off, the skin there is very, very thin, so the filler can show. It's something called the Tyndall effect, and you get like this bluish visible lump of filler, which is not cool. The second issue is you can have a lot of swelling in that area because it's very delicate tissue. So for those reasons, most of the time, I like to add filler right over the top of the cheekbone, deep down right on top of the cheekbone, because you don't get those issues as commonly. But sometimes, once you've done that as a foundation, it's helpful to add a little bit of filler into the tear trough as well. So for the cheeks, I generally use either Juvederm Voluma or Restylane Lift. They're both formulated for that. I personally prefer the Restylane Lift. I've seen a couple patients come to my office from other practices who had an ongoing allergic reaction to the Voluma, where they were just getting red and swollen and puffy intermittently for weeks at a time. I haven't seen that happen with the Lift, so that's generally what I stick with. And then if that's not enough for a good correction, we can add a little bit of Restylane Silk above that, but very cautiously and with the knowledge that it could swell quite a bit. Something to be aware of. All right, so that's lower eyelid filler. The next question I had was about Brazilian butt lifts. The reader wanted to know, what's the recovery time for Brazilian butt lift? Is it dangerous? What do they cost? And how does it actually work? So for those of you who don't know, a Brazilian butt lift is basically the process of suctioning fat from your midsection, so basically liposuction of the waist, hips, and stomach, and then injecting it into the buttocks to get an augmentation of the buttock area. So this has been a really popular procedure, not so much in Cleveland, we don't do a ton of them here, but very much so in like Miami, Texas, California, areas like that. So this has actually been in the news quite a lot lately. There has been a task force created by the American Society of Plastic Surgery and the Society for Aesthetic Plastic Surgeons, and they were investigating the safety of the Brazilian butt lift. The risk of death from a Brazilian butt lift is estimated to be 1 in 3,000. Now, this is a completely elective cosmetic procedure performed on young, healthy patients. So a risk of dying of 1 in 3,000 is very high and basically unacceptable, to the point where this task force was created. What can happen is when the fat is injected into the buttocks, if any of that fat gets under the muscle or into the muscle, there are very large veins that will suck the fat up, and then it can embolize to your lungs and kill you, which is terrible. The other risk, if you don't die, you can end up being dependent on oxygen for the rest of your life because some of your lung tissue dies. Now, many surgeons still perform this procedure. I don't, actually. I never did a ton of them. As I mentioned, they're not super popular in Cleveland, and with that risk, it's just not worth it to me. So if you want a visibly rounder buttocks area, liposuctioning the waist and the hips and the stomach can help because it's basically going to contour that area. But to get a much rounder buttocks, you're looking at implants. Or finding a surgeon who still does fat injections to the butt. There aren't a ton of requests for that in this area, like I said. And I do know a lot of surgeons who are still doing fat injections, but for me, it's just not worth the risk. I really don't want to kill a healthy young person for a procedure that, you know, it's totally optional. And the other thing people don't think about too is, so you have this big round booty in proportion to your tiny little waist, and that's now, but what happens 20 years down the road when you've gained 30 or 40 pounds? The fat that is injected as a graft also gains weight. So your butt is going to continue to be proportionally bigger. And I've seen pictures of patients who've gotten fat grafting to their face or other areas of the body and then gained weight, and it looks terrible. So be aware that if you get fat grafting, fat moved around anywhere, if you gain weight, you're going to gain weight in those areas too. Something to be aware of. I do use fat grafting mostly for breast reconstruction or some cosmetic breast surgeries, and I'll do it conservatively in the face. But again, you want to be careful not to overfill, because down the road, if that person gains weight, they can end up looking really abnormal. Not cool. So that's my take on Brazilian butt lifting. I also have some blog posts on this. We can link to them in the comments, but you can check out my blog at blog-greerplastics.com. You'll find them there, and like I said, we can link to them in the comments. And then again, if you missed the beginning of this video, I do have a free upcoming masterclass on weight loss. I'm going to give you the tips and tricks that helped me lose 45 pounds. And there are 2 sessions of that next week. It's live. So, or excuse me, it's online. It is live, but it's online. So basically you click on a link, it takes you to a website. You'll get to see me talk. You can type in questions. We'll do a live Q&A. Very fun. So if you want to check that out, go to jennifergreermd.com/masterclass. Until then, have a fantastic week.